Wondering how to reconstitute OTESALY PLLavoFill? Follow these steps. Step 1. Reconstitution. Add 5 to 8 ml of sterile water for injection to each 360 mg vial. Never use saline or any solution containing sodium chloride. Ordinarily, add 1 to 2 ml of 2% treat the skin for comfort. Step 2. Hydration. Let it stand for 1 to 5 minutes so the powder fully wets. Step 3. Mix. Gently swirl or shake until the powder completely dissolves into a homogeneous milk-white suspension. Use immediately. Do not stop. If any sediment appears, gently shake well before use. Step 4. Inject. Apply topical anesthetic if desired. Use a 27G needle into the dermis, subcutaneous tissue or supercilious steel layers. Spray before injection to avoid intramuscular placement. Administer via retrograde sliding as you withdraw slowly. It works for temples, cheeks, nasolabial folds, hands, bottom and more. Results last over 24 months with gradual collagen regeneration. Ready to try? Draw your questions below.